Why should men not use soap to wash their face? Because they shouldn't just be using what they use on their body, pumping that as a body wash, or just using a bar soap on their face. Because these soaps were meant for facial sites. They typically can be very dry and very harsh. So I would recommend that men actually get a separate facial wash, just like many women do as well. Take good care of their skin so it doesn't really dry out the skin too much. Many men I know actually don't have proper skin care, so they tend to have very, very dry skin, and they start to complain about that. I get fine lines, I get more sort of like, why is my skin looking so dull, sort of like line ridden. I always say that it's really probably because your skin is too dry, you haven't been using moisturizers, you've been just not washing your skin with proper skin care, and it's very, very harsh. What are the causes of back acne? Well, multifactorial. Typically when people come with acne over the back, it can be a mixed picture, or it can be really truly truncal acne. Many times the young people that I see have also another form of acne called pityrosporum folliculitis. This is actually due to a fungal organism that grows on the body and causes very similar looking pinpoint red papules, very much like acne. Clinically, it's sometimes very hard to distinguish between the two, and oftentimes it's a mixed picture. In a climate like Singapore, where it's tropical and very, very hot, boys that tend to exercise a lot and keep their wet shirts on, they tend to develop this sort of pityrosporum folliculitis as well, and this oftentimes mixed in with truncal acne. So like I mentioned, it's multifactorial. It's probably due to hormonal changes, past teenage years, increased amount of oil secretion that leads to truncal acne, and of course the humidity and the climate in Singapore can predispose you to getting this fungal folliculitis, as I've mentioned. Typically for laser tattoo removal, we're talking about anything between 7 to 10 sessions. I mean, in the past, we used to use only Q-switch lasers, be it a 1064 nanometer laser, which is used for black, a 532 nanometer laser that's used for reds and oranges, as well as a 755 nanometer laser that's used typically for greens. Fast forward many years now, we have picosecond lasers. They tend to be more efficacious at clearing out the pigment faster. So we're looking at possibly a reduced number of sessions, but again, I typically tell patients it really depends on the depth of the tattoo pigment as well as the amount of color in the skin. So I would say typically a good number to estimate will be between 7 to 10 sessions. Birthmarks, they are very commonly bantered about. That terminology is oftentimes used. So one type of birthmark that is quite common is a red birthmark. It's called a port wine stain. A port wine stain is usually congenital. It develops over a segmental area of the face, and that responds very well to a particular laser that we call a vascular laser. Typically, it is a pulse dye laser, and the wavelength that we typically use for that is between 585 to 595 nanometers in terms of wavelength. That really targets red or hemoglobin very well, and that shatters the red blood cells in the red blood vessels and clears out these congenital red birthmarks. What other birthmarks can there be? Sometimes patients develop a zonal sort of black pigment. We call them nevus of Ota or nevus of Ito. This is actually due to melanocytes in the skin. They're typically brown-black in color. Again, these can respond very well to a different type of pigment laser. We're talking about a 1064 nanometer or a 755 nanometer wavelength laser. You should be concerned if your mole is itchy. Why? Because typically what dermatologists would tell patients who are trying to observe their moles on their own is to look for signs of change or evolution. And developing itch is definitely one of the signs of change or evolution. So typically if your mole has never been acting up and is recently itchy, I would actually seek medical advice and have a doctor look at the mole to tell me whether there is any changes that I should be more suspicious about. Other than the mole being itchy, I think there are other symptoms that you should be observant about, and that can be pain, there can be rapid growth, there can be spontaneous bleeding as well. So all these symptoms, if the patient starts noticing them, should lead them to prominent awareness in their mind that they should actually seek medical attention for that. Well, skin that looks bad after you drink typically can be due to a couple of factors. If you've got pre-existing sensitivities, for example, a condition known as rosacea, you may flush very easily with exposure to alcohol. So typically, people with rosacea tend to get extensive flushing. The face gets very, very beetroot red just after half a glass of alcohol. It can continue as well throughout the whole night as well. So it tends to flare up the rosacea condition, and sometimes the rosacea papules, or they're kind of like almost like acne, they tend to erupt the next couple of days as well. Oftentimes also, some people would then anecdotally tell you that after they drink alcohol, they find that they get worsened acne, for example, and that is people without rosacea. Again, that is a common occurrence. Alcohol does aggravate conditions like acne, so typically it also can dehydrate your skin. So if you wake up after binge drinking, over a weekend, you may find your skin looks duller, looks more dehydrated, because alcohol does dehydrate the system. It draws water out overall, so your skin starts to look more dull and more lackluster as well.